Hey, thank you everybody for attending. It's a pleasure for me to introduce you the essence of what we do in Pylon. In a nutshell, we're providing a direct carotid access with a minimal invasive approach. Okay, so what is carotid artery disease? Carotid artery disease occurs when fatty deposits called plaque are built on the vessel wall, lead to narrowing that can eventually lead to strokes. This condition is actually related to 265 strokes and 130,000 deaths in the United States each year. Now I want to start with a short story, the story of 500,000 Americans who are diagnosed with carotid artery disease each year. Only a third of those patients will be treated. Once a patient is diagnosed with carotid artery disease, what are the main alternatives he has? So we have the carotid endarterectomy. It's a relatively long procedure of 3 hours long, in which the physician will make a long incision at the neck, expose the artery, take all the fat and plaque deposit out, and then suture back the skin and artery. This procedure is relatively with high complication of a nerve injury, 2.3%, stroke, 1.5%, and myocardiac infarction of 0.5%. After 3 long days, the patient can be discharged back home. Of course, can only be performed by vascular surgeons. We have the second alternative, it's transfemoral stenting. It's a minimal invasive procedure that's related with a relatively higher stroke rates of about 3.1%. The reason for the higher stroke rates are driven from the fact that the stent has to travel all the way from the groin area up to the carotid. By doing so, particles from the aorta wall can be dislodged and drift into the brain, causing strokes. The physician also has to cross all those fatty deposits with a guide wire and the surgical tool that further increasing the risk. The third alternative he has is a TCAR, is a kind of combination between the two approaches. A smaller incision compared to the CEA is made just above the clavicle, the artery exposed, catheter inserted, and then a stent is placed. This is still a relatively long procedure and still need quite a lot of hospitalization time due to the incision that is made. So, Pylon Medical. We are taking the best elements for both approaches by going directly to the carotid with a minimal invasive approach. By working from the carotid, actually, we are avoiding challenging anatomies and allowing the physician to have better control over the surgical tool that lead to better outcomes. Of course, we're shortening the procedural time by doing the direct carotid access. Adopting the minimal invasive approach is actually reduce the procedural time to half the time compared to other procedures, and shortening the hospitalization time, which will directly reduce the hospital costs. And it can be performed by interventionalists and vascular as well. So what actually we are selling? We are selling 3 things. It's like a 3-in-1 kit. We are selling a closure device that is specially designed for the carotid artery. We are selling an aspiration system that is helping with proximal protection while delivering the stent. And we are selling a balloon catheter that is specially designed for the carotid artery needs. Now, let's see a movie. So, as I mentioned, 500 diagnosed each year, 130,000 deaths. 40% from all strokes occurs due to carotid artery disease. Current alternative, endarterectomy, higher complication. Transfemoral stenting, higher stroke rates. TCAR is not completely closed. Pylon Medical. So we are going directly to the carotid by a micropuncture set, placing a guide wire in the carotid. Once the guide wire is in, we can introduce our closure device on top of the guide wire. And then we are placing a suture from one side of the puncture to the other side of the puncture. Once we establish that, we can continue for the entire procedure by inserting pylons, balloon catheters over the guide wire. Now we have flow from the arch to the brain. We inflate the balloon at the common carotid and block that flow. We still get some backflow from the external to the internal, and then we operate our aspiration system to reverse the flow through our filterized system. Once the blood is reversed, we can insert the filter and continue with a stent. We are stent agnostic. We can use any stent in the market. And then the last thing we have to do is to retrieve the filter, aspirate all the embolic parts. This is how the system looks on the patient. And now the last thing we have to do is actually close the puncture hole. In order to achieve that, we are using another tool in our kit that pushes a knot over to the puncture and adding a collagen layer on top of that for extra safety. The total addressable market is estimated to be $2 billion. The early adopter market is 300 million. This number represents the number for whom a minimal invasive procedure is preferred, but currently cannot go through this procedure due to anatomical conditions. Our cost of goods is 400. Average sales price for distributors 3,015, and hospital price 5,500. We believe that now is the time to approach the direct carotid because it's a high volume transition happening, like Boston Scientific acquired Pylon Medical. A major change occurs in the center of Medicare, in the reimbursement centers that reimbursing the CAS, carotid artery stenting, as a gold standard alongside with the surgery. So the company established a year and a half ago under Medtech incubator. We managed to raise a seed funding, and we successfully tested the device in a preclinical trials and in our labs. We have a strong IP in multiple places in the national and PCT. Okay, our plans for the next couple of years will be in 2025, finalize the design and do all the verification needed. 26, initiate our first human study. For that, to achieve those milestones, we are looking for $5 million that will be used for hire additional personnel and produce the necessary units. Our team includes some of the top KOL in the field, alongside with seasoned engineers and business consultants that's guiding us on our way to success. Thank you for attending.